So during the lockdown, what I did was I took all the care plans that I have written throughout nursing school and I will look on what they were correct about them. So when I used to get back my nursing care plans, I used to see these red inks on the paper and I will become so frustrated because I was like, what am I doing so wrong? Hi guys, welcome back to my channel. For those of you who are new, welcome. Please remember to like, share, subscribe, leave a comment and press the notification bell so that you can be notified when I post a video. So in today's video, I want to share with you some tips and tricks on how to better be able to write nursing care plans in nursing school. Now before I jump into the tips, I just want to share with you a backstory of how I was so bad at writing nursing care plans. It reached a point where I was getting frustrated and I felt as if I would never get it right. But just by following these simple tips that I am about to give to you, I became one of the top nursing care plan students in nursing school. So I want to just share with you these tips and I hope and I pray, guys, I am just telling you that if I did it, you can too. This is not something that anyone told me. This is not something that I am making up. This is something that I tried and it worked for me, and if you try it, it will work for you as well. So during the lockdown, what I did was I took all the care plans that I have written throughout nursing school and I will look on what they were correct about them. So when I used to get back my nursing care plans, I used to see these red inks on the paper and I will become so frustrated because I was like, what am I doing so wrong? Why can't I get it? And I realized that all the comments for the correction was saying the same thing. I was lacking in my assessment, and because I was lacking in my assessment, the rest of my care plan was not properly done. So the first thing I want to encourage you to do, guys, is work on your assessment. Know how to properly and completely assess your patient. This will help you to be better at writing your care plans. Now, it is better to have too much information in your assessment data than too little. And I also want to encourage you to practice. The more you practice care plans, the better your results will be. I want to challenge you to get a notebook specifically for care plans, and I want to encourage you to do at least 3 nursing diagnoses per day. Now for your final clinical exam, you will be doing 3 nursing care plans, which is comprises of 9 nursing diagnoses, and I am challenging you to do 3 nursing diagnoses per day. I promise that if you dedicate yourself to doing this, you will be better at writing care plans. Guys, I know it is hard when you're in the clinical area. I know the workload is heavy because sometimes the nurses don't give you a chance to even write one care plan. But when you get home, do not go to sleep until you have completed writing these care plans. I promise that it will help you. And I know as nursing students, I was in the same boat with you, that we tend to choose the patient that are more stable. Guys, especially if you're in your final clinicals, which is your 4th year of nursing school, I will encourage you not to do this. Choose the patient that as you look on them, you see nursing diagnosis start jumping out at you. Because if you choose the patients that are more stable, yes, they have nursing diagnosis because they're at the hospital for a reason, so of course something is wrong with them. But you will find out that you have to dig deep to find the nursing diagnosis, and you don't want to do that. You are running the chance of not completing your care plans per day. Also, guys, what you want to do is to read up on your pathophysiology for each condition before you start writing your care plan, because if you know the pathophysiology, then you will know what interventions you can do for this patient to have a better outcome for the patient. Read the patient's file/docket to get the tests and the labs that was carried out for this patient while the patient is at the hospital, because this will be additional assessment data to back up your nursing diagnosis. Guys, this is very, very important, because as I said, you don't want your assessment data to be lacking. It's better to have more information in your assessment data than less information. Guys, this is part 1 of a series that I am doing on care plans, so stay tuned for that. If you have a friend also who is really poor at writing nursing care plans, let them tune into this, because I am going to go in depth. As I said, I was bad at nursing care plans and I was one of the top students, so you can do it as well. Thank you so much for watching this video, and please stay tuned for my next one. Bye.